Learning goals. Welcome to this learning session on breathing techniques for life. In this course, we shall address science of breath and physiology, foundations of diaphragmatic breathing, performance and recovery techniques, clinical and immune applications, ancient wisdom and mental health. There will be a quiz at the end to test the science of conscious breathing. Breathing is unique because it is the only autonomic function that humans can consciously override to influence their internal physiological state. By shifting from automatic to deliberate respiration, individuals can directly modulate their nervous system, immune response, and cardiovascular health. Research indicates that these interventions significantly reduce self-reported stress and depressive symptoms across diverse populations. Historically rooted in ancient traditions like Tibetan Buddhism and Hatha Yoga, these practices are now validated by modern clinical meta-analyses. The ability to control the breath acts as a direct dial to the brain's regulatory centers, fostering resilience and emotional stability. As digital overwhelm increases globally, mindful breathing has emerged as a critical tool for maintaining mental clarity and overall vitality. Heart rate variability and autonomic balance. The primary mechanism behind breathwork is the shift between the sympathetic fight-or-flight system and the parasympathetic rest and digest system. Heart rate variability, or HRV, serves as the definitive measurable marker for this autonomic balance and overall cardiovascular resilience. Higher HRV scores are consistently associated with better stress management and improved emotional regulation capabilities. Studies demonstrate that even a brief 2-minute session of slow nasal breathing can measurably increase parasympathetic tone via vagal innervation. Specific metrics such as SDNN and RMSSD show significant improvements during these controlled sessions, indicating enhanced autonomic regulation. This physiological shift occurs rapidly, making breathwork an efficient intervention for acute stress in high-pressure environments. Foundations of diaphragmatic breathing. Diaphragmatic breathing, often called belly breathing, is the fundamental technique upon which all other breathwork practices are built. It involves inhaling deeply through the nose to engage the diaphragm, causing the abdomen to rise rather than the chest. This method maximizes oxygen exchange and is the most extensively studied technique in contemporary medical literature. Inhale deeply through the nose. Allow the belly to expand outward. Exhale slowly and fully. Repeat for several cycles to stabilize the core. Clinical applications of belly breathing. Clinical research highlights the efficacy of diaphragmatic breathing in managing chronic conditions such as COPD and hypertension. For instance, patients with post-COVID-19 syndrome showed substantial improvements in exercise capacity, with 6-minute walk distances increasing by up to 175 meters. These physical gains are accompanied by enhanced respiratory muscle strength and reduced dyspnea. Beyond respiratory health, this technique is effective in treating functional constipation, migraines, and GERD by improving vagal tone. It also plays a significant role in reducing cortisol levels, especially when integrated into a broader wellness routine. This makes it a versatile adjuvant therapy for both physical ailments and psychological disorders like anxiety. Discover the power of box breathing, a technique proven to enhance focus and calm under pressure. Learn how this simple method can transform your performance. Box breathing, also known as four-square breathing, is a potent technique utilized by high achievers like Navy SEALs, elite athletes, and surgeons. It is designed to maintain concentration during periods of intense stress. The practice involves 4 distinct phases of equal duration: inhaling, holding the breath after inhaling, exhaling, and holding the breath after inhaling, exhaling, and holding the breath after exhaling. Each phase is held for a count of 4. This consistent rhythmic pattern is key. This rhythmic pattern stabilizes the autonomic nervous system, effectively preventing the panic response during critical tasks. For individuals with ADHD, box breathing offers significant benefits by enhancing executive function and aiding in the management of impulsivity through present moment grounding. Research consistently shows improvements in mood and a reduction in overall respiratory rate. Furthermore, by increasing vagal tone, it empowers performers to remain calm and analytical even in high-stakes situations. The 4-7-8 technique for sleep. The 4-7-8 breathing technique is a specialized form of pranayama designed to act as a natural tranquilizer for the nervous system. By inhaling for 4 seconds, holding for 7, and exhaling for 8, the practitioner activates the parasympathetic brake on the heart. This extended exhalation is the key to slowing the heart rate and preparing the body for deep rest. Consistent practice of this method has been shown to improve sleep quality across diverse patient groups over a 1-month period. Many proponents claim it can help an individual fall asleep in as little as 60 seconds by rapidly reducing anxiety. It serves as an effective, non-pharmacological intervention for insomnia and chronic nighttime restlessness. Coherent breathing and information control. Coherent breathing, also known as resonance breathing, involves maintaining a steady rate of approximately 5 to 6 breaths per minute. This specific frequency optimizes the heart's rhythm and enhances vagal afferent activity, which has profound effects at the cellular level. It is particularly effective at inhibiting pro-inflammatory cytokines such as TNF-alpha and IL-6. By attenuating systemic inflammation, coherent breathing promotes long-term cardiovascular resilience and emotional regulation. This technique is not merely calming, it actively combats the biological markers stress that lead to heart disease and diabetes. Practicing this for just 10 minutes a day can significantly improve one's physiological profile. The Wim Hof Method. Immune modulation. The Wim Hof Method. Immune modulation. The Wim Hof Method. Duochem combines deep cyclic hyperventilation with breath holds and cold exposure to stimulate the sympathetic nervous system. This unique approach triggers a surge in epinephrine, which subsequently increases the production of the anti-inflammatory mediator, interleukin-10. This mechanism allows practitioners to voluntarily influence their innate immune response. While polarizing, the WHM is increasingly well studied, with research showing its potential to reduce markers of chronic inflammation. However, safety is paramount. The method involves intentional hyperventilation and should never be practiced in water or while driving. When performed correctly, it builds significant mental toughness and physiological resilience to environmental stresses. Pranayama, Ancient Wisdom and Modern Vitals. Pranayama, Ancient Wisdom and Modern Vitals. Pranayama encompasses a variety of yogic breathing techniques designed to harmonize energy flow and enhance parasympathetic activation. Methods like Nadi Shodhana. These practices promote emotional balance and have been shown to improve vital capacity and peak expiratory flow. Specifically, left nostril breathing is associated with a decrease in cardiovascular parameters, making it a useful adjuvant for hypertensive patients. Beyond physical benefits, pranayama is used by athletes to enhance endurance and mental toughness. It serves as a bridge between physical discipline and mental clarity in both traditional and modern contexts. Nasal versus mouth breathing physiology. The choice between nasal and mouth breathing has significant consequences for physiological economy and athletic performance. Research indicates that breathing exclusively through the nose can reduce total ventilation by approximately 22% for the same workload. This efficiency allows for greater oxygen extraction without increasing metabolic demand during submaximal exercise. In elite endurance athletes, nasal breathing at the first ventilatory threshold improves oxygen extraction by nearly 14%. Furthermore, it is associated with better vascular recovery after anaerobic exercise due to improved flow-mediated dilation. Transitioning to nasal breathing can therefore accelerate post-workout recovery and enhance overall cardiovascular health. Pursed lip breathing for recovery. Pursed lip breathing is a clinical technique specifically designed to reduce breathlessness and improve quality of life for those with serious respiratory illnesses. The method involves inhaling through the nose for 2 counts and exhaling slowly through pursed lips for 4 counts. This creates back pressure in the airways, keeping them open longer during exhalation. This technique is especially valuable during physical exertion or when recovering from a respiratory flare-up. By slowing the breathing rate and improving the exchange of oxygen and carbon dioxide, it helps patients regain control over their breath. It is a cornerstone of pulmonary rehabilitation programs worldwide due to its simplicity and immediate effectiveness. The bridge to mental and physical health. Consistent breathwork practice serves as a vital bridge between the conscious mind and the autonomic nervous system. Just 5 to 10 minutes of daily practice can boost physiological resilience and emotional regulation within a few weeks. This cumulative effect is akin to training a muscle, where the nervous system becomes more adept at returning to a state of calm. Ultimately, each breathing technique is a specialized tool for accessing different physiological states, whether for energy, focus, or healing. By integrating these practices into daily life, individuals can take proactive control of their health and mental well-being. The breath remains the most accessible and powerful instrument for human optimization and long-term. Summary: well done. You have completed the course, Breathing Techniques for Life. You should now be familiar with Science of Breath and Physiology, Foundations of Diaphragmatic Breathing Performance and Recovery Techniques, Clinical and Immune Applications, Ancient Wisdom, and Mental Health. Should you need to revisit any of the topics in this course, please use the menu at the bottom of the screen.